New legislation has been announced to tighten oversight on the compounding pharmacies following last year's deadly meningitis outbreak. 22 News State House reporter Christine Lee standing by on Beacon Hill to explain how the new rules will prevent major health scares in the future.
Governor Patrick has announced new reforms that will allow the state to better monitor, license, and penalize compounding pharmacies, which, as we saw last year, are capable of creating a national health crisis if left unchecked. Governor Deval Patrick has announced new legislation to strengthen oversight over the compounding pharmacy industry. 39 people are dead and more than 600 people sickened nationwide because of a meningitis outbreak linked to the New England Compounding Center in central Massachusetts.
Together, these changes can ensure that the significant harms that we have seen from substandard compounding never happen again.
The reforms include creating special licenses for sterile compounding pharmacies, fines against pharmacies that violate state regulations, and whistleblower protections for pharmacy staff. It requires compounding pharmacies to report how much and where they send medications so the state can determine whether they're operating as a local pharmacy or mass manufacturer. Manufacturers are subject to regulation by the U.S. Food and Drug Administration.
What we saw happen with NECC is it was a manufacturer in pharmacy clothing. And so several of the regulations that have been put in place are there precisely to be able to identify that.
Governor Patrick will also direct the Department of Public Health to increase inspection staff at the State Board of Pharmacy and also make sure that members of the board include people from outside the pharmacy industry. Legislators say and state officials say that these reforms will make Massachusetts a leader in overseeing the compounding pharmacy industry, and they expect the rest of the country to eventually follow our example. Live in Boston, Christine Lee, 22 News.